Life throws curveballs, doesn't it? Whether it's a big life change, a traumatic event, or just, the everyday grind, we all face challenges.
We certainly do.
But what separates those who don't just survive, but truly thrive? What allows some people to not just bounce back, but seemingly bounce forward? Today, we're diving deep into that incredible human capacity, resilience. We'll unpack what it truly means, explore the coping strategies that make a real difference.
I will look at cognitive behavioral therapy, CBT.
Exactly, and how it can be a direct path to bolstering your own adaptability and inner strength. So let's get into it. There's a lot more to resilience than just gritting your teeth, isn't there?
Absolutely. That common idea of just toughing it out, it often misses the true nature of resilience.
Right.
It's not really about being immune to stress. It's more about possessing these adaptive defenses, your inner strengths, your strategies that allow you to persevere and actually grow from challenges.
That distinction is so important. So what is resilience then at its core? Our sources, including the American Psychological Association, they define it as, let me get this right, the process and outcome of successfully adapting to difficult or challenging life experiences, especially through mental, emotional, and behavioral flexibility. That definition alone tells you it's more than just a fixed trait, right?
It really does. And the research consistently shows that resilience is, well, it's a universal human capacity. And crucially, it's a learned skill.
Learned, okay.
Yeah, something you can actually develop over time.
Yeah.
Through practice, through experience. It's not simply bouncing back to where you were before a challenge hit. Often it's about bouncing forward, learning from the experience so you're better equipped to handle future challenges. The core quality truly is adaptability.
I love that idea, bouncing forward. It implies growth, doesn't it?
It does.
So if it's a skill we can learn, what are the key components? What makes up this resilience muscle we're trying to build? What makes someone resilient?
Well, the research points to several key components. These include things like self-awareness, definitely strong problem-solving skills, emotional regulation.
Managing your emotions.
Exactly. And having robust social support systems. Resilient individuals also tend to have what's called an internal locus of control.
Okay, what does that mean? Internal locus of control.
It basically means they believe their actions can truly affect outcomes. They don't just feel like they're at the mercy of external circumstances.
Yeah.
Think of it as feeling like you're the driver of your own life, not just, a passenger reacting to traffic.
Got it.
They also tend to exhibit a survivor mindset, actively seeking solutions, avoiding that victim thinking. And finally, self-compassion, treating yourself with kindness and a balanced optimism are highlighted as vital aspects too.
So it really does sound like resilience isn't just about being tough, like we said, but something we can actively develop within ourselves, almost like a muscle.
It is. It's a dynamic process. It's influenced by both our inner psychological state and our environment. It's definitely not a simple either you have it or you don't kind of binary.
Which is great news, really.
It is, because it means we can always cultivate more of it.
Now, sometimes you hear terms like hardiness and grit used right alongside resilience. Are they just different words for the same thing, or?
That's a great question. They're often used interchangeably in, everyday conversation, but scientifically they have quite distinct meanings.
Okay.
And understanding these distinctions is important because their implications for mental health, for personal growth, they can differ significantly.
Let's start with hardiness then. How does that fit into the picture?
Okay, so hardiness. It's characterized by 3 specific attitudes that help people face stress. First, there's control, that belief that you can influence your surroundings.
Right.
Second, commitment, staying actively engaged rather than becoming passive or withdrawn. And third, challenge, viewing change as normal, maybe even an opportunity for growth. Hardiness is really considered an aspect of the broader concept of resilience. It fits into that larger picture.
Okay, so it's part of resilience. And what about grit? I hear that one a lot, especially when people talk about achievement and perseverance.
Yeah, grit gets a lot of airtime. Grit focuses specifically on perseverance and consistency in pursuing long-term goals, even when you face setbacks. It emphasizes constancy over adaptability.
Constancy.
Right. It's about sticking to the same goals, the same path, maintaining effort, even when things get tough.
This is where it gets really interesting for me.
Yeah.
Because these aren't just synonyms then. It seems like sometimes being too gritty might actually hold us back.
You're hitting on a really crucial point there. blindly pursuing constancy, when what's really needed is adaptability, well, that can sometimes lead to digging yourself into a deeper hole.
Huh.
For instance, the sources point out that grit can actually decrease resilience in situations that demand flexibility.
Can you give us an example of that?
Sure. Think about, say, a student taking a really difficult test. If they're overly gritty, they might stubbornly spend all their time on one impossible question.
Right, just banging their head against the wall.
Exactly. Instead of recognizing it's maybe a dead end for now, moving on, and maximizing their score on other questions they can answer, a resilient approach would be to pivot, to reallocate that effort.
So resilience involves knowing when to pivot, not just when to push harder. That makes so much sense.
It truly does. There was actually a study on U.S. undergraduates who were on academic probation,
Okay.
and it found that resilience, not grit, predicted whether those students facing significant setbacks would stay in school.
Wow.
And the thinking is this is because resilience allows you to accept setbacks, to try new approaches. Grit, being focused on constancy, might not offer that same flexibility.
Interesting.
The sources even observe that sometimes policymakers can mistake resilience for grit when they design systems. They might try to make systems resistant to change.
Thinking that makes them stronger.
Right, but this can actually reduce true resilience because it prioritizes that constancy over adaptability. True resilience, again, it really involves being open to change, being flexible.
So life's challenges are, well, they're relentless sometimes, and our resilience is constantly being tested. What are some of the most common ways it gets put to the ultimate test?
Well, first, let's remember that a certain level of stress is actually good for us. It can motivate, give us energy, act as a warning system,
Sure.
and even prepare us for future challenges. But resilience is truly tested by significant life changes.
Okay.
These can be negative events, obviously, like a divorce or losing a job. But surprisingly, even positive ones can test us, like graduating college or getting married.
Really positive changes, too.
Yeah. These transitions often bring a lot of uncertainty and stress. And research indicates they can lead to reduced adjustment, increased distress for a time. But resilient individuals tend to view these changes, even the tough ones, as opportunities for growth.
And what about more severe challenges? Things like trauma and adversity.
Absolutely. Traumatic experiences, physical violence, natural disasters, the profound loss of a loved one, these can deeply affect our mental status, our well-being.
Understandably.
And childhood adversity, in particular, is strongly linked to increased vulnerability and potentially reduced resilience in adulthood. But despite this, studies show many individuals demonstrate remarkable resilience even after severe trauma. They find ways to adapt, sometimes even thrive.
Then there are those challenges that just seem to drag on
Yeah.
without a clear end in sight.
Yes, chronic stressors, those are a major factor. Ongoing challenges like, say, financial strain, chronic illness, or persistent discrimination, they can gradually erode resilience over time.
Because they just keep coming.
Exactly. Unlike acute events, these often lack a clear endpoint. They just keep draining us mentally, emotionally, physically. And chronic stress is linked to various health issues, cardiovascular problems, a weakened immune system.
So how do we even begin to face these relentless challenges effectively without just burning out? It sounds like we need a toolkit.
That's it, exactly. It really highlights why developing robust coping mechanisms isn't just about managing a single crisis. It's a continuous process, essential for long-term well-being.
That makes perfect sense.
Yeah.
So let's talk about those coping mechanisms. What's the difference between strategies that actually help us long-term and, well, those that might feel helpful in the moment but cause more problems down the line?
Yeah, that's a key distinction. We talk about adaptive versus maladaptive coping strategies.
Okay.
Adaptive coping means navigating stressors with productive solutions. It involves flexibility, effectiveness, and maintaining a positive mental attitude. Things like optimism, hope, the ability to see potential for growth. These are the strategies that actually build your capacity over time.
And maladaptive coping is the opposite.
Precisely. These are strategies that offer maybe temporary relief but lead to greater long-term difficulty. Common examples include denial, avoidance, substance abuse, self-sabotage.
Things we probably all recognize.
Oh, definitely. Emotional eating, overworking, suppressing emotions instead of dealing with them. These might feel good or at least numb in the moment, but they prevent genuine resolution and can just perpetuate the problems.
So what are some of the truly productive adaptive ways we can cope? How are they categorized?
Well, the sources often categorize adaptive coping strategies into four main domains.
Yeah.
First, there's appraisal-focused coping. This is about attempting to understand and find meaning in a crisis, using cognitive strategies to kind of reframe the situation.
Changing how you see it.
Exactly. Second, problem-focused coping. This involves directly tackling the issue itself to reduce or eliminate the stressor. It's a very practical, reality-based approach.
Makes sense.
Third, emotion-focused coping. Here, you manage your emotional response through things like relaxation techniques, meditation, maybe seeking social support just to vent or feel understood. This is particularly useful for stressors you can't directly change.
Right, when you can't fix the problem itself.
Precisely. And finally, there's social coping, or seeking social support. Just reaching out to others for emotional backing or practical instrumental help.
It sounds like we need to be really honest with ourselves, then, about how we're currently coping.
Yeah.
Are we truly solving problems, or are we just kind of pushing them away?
That's a powerful self-assessment question, isn't it? Are the strategies we're using helping us truly bounce forward, or are they just providing a quick, often counterproductive escape hatch?
So, if resilience is a skill, like we established, how do we actively cultivate it? What practical steps can you, our listener, take right now or this week to develop a more resilient mindset?
You're right. Resilience can absolutely be developed. It takes practice and experience. One key strategy the sources highlight is cultivating optimism.
Okay, how do we do that?
Well, it means actively working to view setbacks as temporary and specific rather than seeing them as permanent and pervasive, affecting everything.
So, not everything always goes wrong for me?
Exactly. More like, this particular thing went wrong and it's a temporary situation. Research consistently shows optimistic people are generally emotionally, mentally, and even physically healthier.
That's a powerful shift in perspective, just how you frame things.
It fundamentally changes your experience, yes. Another vital practice is self-compassion.
Being kind to yourself.
Yes, treating yourself with kindness and understanding, especially during difficulties. It has three components. Mindfulness, being aware of your suffering. Self-kindness, being gentle with yourself. And common humanity, recognizing that suffering is part of the shared human experience. Self-compassion is truly at the root of healthy resilience. It helps you bounce back faster.
And that's not about letting yourself off the hook necessarily, but about being gentle and supportive when you're struggling, right? Like you would with a friend.
Exactly like you would with a friend. You also want to try and find meaning in adversity.
How does that work?
It means actively searching for ways to make sense of challenging experiences, trying to transform them into opportunities for personal growth or deeper understanding. Think about someone who, say, loses their job, but then uses that experience to pivot into a career they find much more fulfilling.
Turning a negative into a positive, essentially.
In a way, yes. Or at least finding value or learning within the difficulty. And something as simple as humor can play a role, can't it?
Humor. Really?
Absolutely. Humor is strongly associated with greater well-being and resilience. It acts as a coping mechanism. It's a psychological defense. It's even considered a character strength. It relieves pent-up pressure, and some research even suggests it can support immune functioning. So finding reasons to laugh is genuinely helpful.
I love that. What else can we add to our resilience toolkit? Practical things.
Okay, well, don't hold on to the past unnecessarily. You need to practice releasing regret. Acknowledge it, learn from it, absolutely, but then let it go so you can focus on the present and future.
Easier said than done sometimes, but important.
Very true. Also, consistently garnering gratitude. Actively noticing and appreciating the good things in your life leads to better mental, emotional, and physical health. And something really fundamental, move more. Regular exercise is strongly correlated with resilience.
So physical activity truly plays a part in our mental fortitude, too. It's not just physical health.
Definitely not. They're deeply interconnected. What about our approach to learning and challenges themselves?
Good point. Develop a growth mindset. That means embracing challenges as opportunities for learning and growth, rather than seeing them as threats or signs of failure.
And crucially, build social support. Actively cultivate strong relationships with friends, family, community members. These connections are invaluable buffers against stress.
And keep coming back to connection.
It's fundamental. And don't forget self-care. Prioritize activities that promote your physical, mental, and emotional well-being. Things like adequate sleep, healthy eating, stress reduction techniques like mindfulness meditation, or deep breathing exercises.
And finally, that core concept we discussed right at the beginning, flexibility.
Yes, embrace flexibility and adaptability. Recognize that change is natural, Practice reframing negative changes positively when possible. Remind yourself that setbacks are usually temporary.
The American Psychological Association actually has a great list. There are 10 ways to build resilience.
They do, and it covers many of these points. If I were to pick just a few that really tie these themes together, it would be making connections with people, accepting that change is a part of living, and nurturing a confident, positive view of yourself. Those three really capture the social, the adaptive, and the internal aspects we've been discussing.
These are truly actionable insights, things you, listening, can start integrating into your life today. They foster greater health, happiness, and fulfillment.
And remember, just like learning any new skill, consistency is key. Practice really does make perfect, or at least progress, when it comes to building resilience.
Now, when we talk about actively building resilience, one powerful tool that comes up repeatedly in our sources is cognitive behavioral therapy, or CBT. What exactly is CBT, and how does it help people become more resilient?
Right, CBT. It's a form of psychotherapy that fundamentally focuses on challenging unhelpful, often irrational, negative thoughts and beliefs. What therapists sometimes call self-talk.
Okay.
And the goal is replacing that negative self-talk with more rational, positive self-talk. It's very problem-focused and action-oriented. It helps individuals develop concrete coping strategies and improve their emotional regulation skills. It was originally developed by psychoanalyst Aaron Beck back in the 1950s.
So it's not just about talking about your feelings, though that's part of it, but actively restructuring your thought patterns. Where did this approach come from? Its history.
Its historical roots are quite interesting. They blend ancient philosophical traditions like Stoicism, which use logic to discard false beliefs, with modern psychology.
Fascinating.
It evolved from early 20th century behavior therapy pioneers like Watson and Skinner, and later the cognitive therapy wave of the 1960s, with figures like Albert Ellis and Aaron Beck himself. These two approaches, behavior and cognitive, they sort of merged in the 1980s and 90s. CBT became this umbrella term for many cognitive-based psychotherapies, including what are sometimes called third-wave therapies like dialectical behavior therapy, or DBT, and acceptance and commitment therapy, ACT. This evolution has made it very adaptable.
That's a rich history. And how effective is it considered in the clinical world, especially for bolstering the kind of resilient skills we've been talking about?
Well, CBT is widely recognized as an evidence-informed treatment for a very broad range of mental health conditions, and its effectiveness directly translates to building resilience.
Well, so.
For example, it's a first-line treatment for many anxiety disorders, and for conditions like PTSD, it specifically helps individuals process trauma and develop healthier coping mechanisms instead of avoidance. Avoidance undermines resilience. Right?
Absolutely.
So CBT directly targets that. It's also often recommended as the first line of treatment for many psychological disorders in children and adolescents, like exposure and response prevention. A specific form of CBT is key for pediatric OCD. And while it can be effective alone for something like severe depression, it's often found to be even more effective when combined with medication.
So it's not just for treating existing conditions. Can it help prevent problems too? Build resilience proactively?
Yes, absolutely. That's a significant area where CBT contributes to resilience. For anxiety, studies show CBT can significantly reduce the likelihood of developing generalized anxiety disorder episodes and other anxiety symptoms in people considered at risk.
Proactive defense.
Exactly. And for depression, interventions that include CBT have been shown to reduce incidence rates, helping people build that psychological defense before challenges become severe mental health conditions.
It sounds like a really powerful tool. Is it still something that mostly happens in a therapist's office one-on-one? Or has it become more accessible?
The accessibility of CBT has really expanded dramatically, which is great news. While traditional therapist-led sessions, typically, maybe 6 to 18 sessions over a few months, often with homework assignments between sessions, are still common. There's also computerized or internet-delivered CBT, CCB or ICBT.
Online therapy.
Yes, and this has proven to be effective, it's cost-effective, and it greatly improves access to therapy for many people. Research suggests similar effectiveness to face-to-face sessions for things like adolescent anxiety and insomnia.
Wow.
Even smartphone apps are emerging now. There's research underway on AI chatbot applications designed to support mental well-being and psychological resilience, offering contextual, always available support.
The future is here.
It's moving fast. Beyond that, even self-help materials like workbooks based on CBT principles and group educational courses have also proven effective ways to learn these skills.
So zooming in a bit, how does psychotherapy, especially CBT, directly support the building of resilience? What are the core goals that make it so effective for this purpose?
The sources tend to highlight 4 interrelated core goals. First, identifying resilience deficits.
Okay, what does that involve?
Therapists help clients recognize their own maladaptive coping strategies. Things like substance abuse, self-sabotage, avoidance, that negative self-talk we mentioned. They might also assess stress vulnerability, using models that help map out how someone's inherent predispositions interact with life's pressures. And, critically, they help process personal trauma history, where avoidance is often a key short-term coping mechanism that becomes a long-term problem for resilience.
So understanding where you're struggling, where the gaps are, is the first step. What's next?
Second, building psychological flexibility. This is a core concept particularly emphasized in acceptance and commitment therapy, or ACT, which is often considered a type of CBT.
Psychological flexibility. What does that mean?
It involves a few things. One is learning to accept difficult emotions, kind of turning toward them with acceptance, rather than fighting or suppressing them. Practicing mindfulness helps here to calm inner turmoil and observe emotions as temporary states.
Instead of being overwhelmed by them.
Exactly. It also means clarifying your personal values, identifying your core beliefs about what's important, to guide your decision-making and provide a sense of purpose, especially when things are tough. And finally, committing to meaningful action, engaging in behaviors that are aligned with your values and long-term goals, even when you feel fear or uncertainty.
That sounds like a really profound shift in how you approach your internal world. Instead of fighting your feelings, you're working with them to move towards what matters.
It is a very different orientation. The third goal is strengthening social connections.
Back to relationships.
Always. Psychotherapy, including CBT, often helps improve communication skills, develop empathy and trust, and learn how to create and maintain healthy support systems. All of this contributes to overall emotional intelligence and therefore resilience. It's about learning to form and keep strong, authentic relationships,
which are vital buffers, as we said. And finally,
the fourth goal is cultivating mind-body resilience.
The mind-body connection.
Yes. This involves integrating relaxation techniques like progressive muscle relaxation or autogenic relaxation, promoting physical wellness because, as we noted, exercise is strongly correlated with stress resilience and self-efficacy, and practicing mindfulness meditation.
How does mindfulness help here specifically?
Mindfulness helps you engage with the present moment, reduces rumination on past problems or future worries, and fosters self-regulation and that internal locus of control we talked about. Some neuroimaging studies even suggest mindfulness meditation is associated with actual structural and functional changes in the brain related to self and emotion regulation.
It's really remarkable how comprehensive CBT seems to be in building these exact skills we've been discussing all along. Essentially gives you a roadmap for thriving.
It really can function like a resilience gym, directly targeting those areas for growth.
And its adaptability and delivery from in-person sessions to apps makes these powerful tools potentially more accessible than ever.
That accessibility is a huge development, potentially democratizing these tools for resilience building.
Now, as with any powerful tool, it's important we look at the full picture. We should acknowledge not just its strengths, but also the areas where CBT faces critique or ongoing discussion. What are some of the criticisms leveled against it?
That's a fair point. One area of ongoing discussion is its relative effectiveness compared to other therapies. While, yes, much research highlights CBT's benefits, especially for things like anxiety and depression, some meta-analyses question if it's significantly more effective than other established treatments. They sometimes find smaller or maybe clinically insignificant effect sizes when comparing CBT directly to other active therapies in certain studies. Some studies even suggest it's no better than non-specific control interventions for conditions like schizophrenia and might have relatively small effects for major depressive disorder compared to initial hopes.
So the science isn't entirely settled on its universal superiority over other approaches. Are there methodological concerns with the research itself, things that make it hard to compare?
Yes, there are definitely methodological concerns. A big one is the inherent difficulty or impossibility of double-blinding in psychotherapy trials. Meaning both the patients and the therapist typically know which treatment is being given. Unlike, say, a drug trial where you can have a placebo and neither doctor nor patient knows who got what. Critics argue this lack of blinding can potentially inflate the perceived effectiveness of CBT, or any talk therapy, really, due to expectation effects. It's a fundamental challenge for this type of research.
That makes sense. If you believe you're getting the gold standard treatment, that might influence how effective you feel it is. What about its effectiveness over time? Has it stayed consistent?
That's another point of discussion. A significant 2015 meta-analysis actually found that the positive effects of CBT, specifically on depression, seem to be declining since 1977, with a steeper decline observed between 1995 and 2014.
Declining. Why would that be?
Well, the researchers offered potential reasons. It could be due to issues like inadequate therapist training as CBT became more widespread, maybe waning patient hope or expectation over time, or perhaps a failure in some settings to adhere strictly to the treatment manuals as designed. It's complex.
That's a really significant finding to consider. Are there also challenges with people actually sticking with the treatment dropout rates?
Unfortunately, yes, that's another critique. Some studies have noted that CBT trials tend to have higher dropout rates compared to some other therapies. One figure mentioned was around 17% higher. This seems particularly true for certain conditions, like anorexia nervosa. It suggests that for some individuals, the structure or demands of the therapy might be difficult to maintain long enough to see full benefits.
Okay. Beyond the empirical data, the effectiveness studies, are there philosophical critiques of CBT? Concerns about its underlying assumptions?
Indeed, there are. Some critics suggest there might be underlying philosophical assumptions in CBT that warrant scrutiny. For example, some argue it might present a less nuanced view of human agency, perhaps overemphasizing external stimuli as the primary cause of thoughts and emotions. Other concerns include the idea that CBT might sometimes focus too much on symptoms, rather than digging into deeper underlying causes, particularly in complex disorders like major depressive disorder. Or, conversely, that it might be best suited only for simple or superficial problems, not deep-seated issues.
And what about potential harms or side effects? Is therapy always harmless?
That's an important question. While CBT is generally considered to have few side effects compared to, say, medications, there are increasing calls within the field for more systematic appraisal of potential harms. Therapists themselves sometimes report observing unwanted events during treatment, things like temporary negative well-being or increased distress as difficult issues are confronted. It highlights the need for careful monitoring and tailoring the approach to the individual. Therapy isn't always easy.
It sounds like there are also broader concerns, maybe sociopolitical ones, about how CBT is implemented on a larger scale in healthcare systems.
That's right. Some critics argue that the widespread promotion and funding of CBT, particularly in public health systems, might be linked to a broader societal focus on delivering quick, efficient, quantifiable solutions fitting a certain kind of economic model.
Okay.
For instance, initiatives like the UK's Improving Access to Psychological Therapies program, IAPT, which heavily favors CBT, were criticized by some psychotherapists. They argued it could potentially undermine traditional, perhaps longer-term psychotherapy by limiting approved therapies, sometimes resulting in what they felt was watered-down CBT delivered by staff with less extensive training.
So a potential trade-off between access and depth or quality.
Exactly. It raises important questions about how we balance making therapy accessible to more people while also maintaining the quality, depth, and diversity of therapeutic approaches available.
That's certainly an important conversation to continue having. How do we ensure quality and address these valid critiques while still leveraging CBT's significant evidence-based strengths in supporting mental health? And crucially for our discussion today, building resilience. So today, we've taken a really deep dive into psychological resilience. We work to understand it not as some fixed trait you either have or don't, but as a dynamic, learnable capacity. A capacity to adapt and even thrive when faced with challenges. We've explored effective coping strategies, the adaptive ones that help us move forward, and the maladaptive ones that can hold us back. We've looked at the kinds of challenges that really test our resilience.
And we examined how cognitive behavioral therapy, CBT, offers a structured, evidence-based approach to strengthening these vital skills, building that resilience muscle.
Remember, cultivating resilience offers profound benefits across your physical, mental, emotional, and social well-being. It really fosters greater health and fulfillment in your life overall.
So as you reflect on everything we've discussed in this deep dive, maybe consider this. What single small step could you commit to taking this week, starting today perhaps, to actively bounce forward in your own life? How could you apply just one of the strategies we talked about, maybe self-compassion, maybe reframing a setback, maybe reaching out for support to transform a current challenge, even a small one, into an opportunity for growth? Just as we've learned, resilience allows